Having laparoscopic endometriosis excision surgery is like jumping into the unknown. I had a vague idea of what to expect from it, but it wasn't enough. And here's what I went through, and maybe it'll help you understand what to do and expect after endometriosis excision surgery. As always, please remember that I am a patient who is sharing her experiences. I am not a medical professional, so please seek professional advice from your endometriosis surgeon before following anything mentioned in this video. I have divided this video into two sections. The first is what to do after laparoscopic endometriosis excision surgery. And the second is what to expect after laparoscopic endometriosis excision surgery. In case you wish to skip any parts of this video, you can with the guidance of the contents list mentioned in the timestamps section in the description box. Also, if you haven't already done so, please subscribe to my channel and share so that we can spread the word about endometriosis. Okay, let's begin with what to do after laparoscopic endometriosis excision surgery. Well, actually, in case you're wondering how to prepare for it, I've linked it in the description box and in a pop-up in this video. It should pop up somewhere, I hope. Now, let's get back on track. What should you do after excision surgery and what should you expect? I want to share some common pointers that I found very helpful. One, what to wear after endometriosis surgery. Loose, comfortable clothing is your best bet. Be careful of elastic bands that could add pressure on the stomach and the stitches. Number two, additional care on your ride home after surgery. In my earlier video on how to prepare for endometriosis laparoscopic excision surgery, I've explained the importance of keeping a cushion on your stomach and the seatbelt on top. It'll help reduce impact and unnecessary pain. Number three, walking after laparoscopic surgery. So walking reduces cramping and helps dissipate the gas that has been pumped in you during surgery. Otherwise, dealing with gas pain, especially the one that travels to your shoulder, is sharp, stabbing, and very uncomfortable, and you don't want to go through that. So what you do not do is that you also do not bend or lift anything heavy for at least 6 weeks or until your doctor doesn't allow you to do so. The same goes for abdominal exercises, not advised. Number four, taking a hot shower and drinking hot tea is helpful for recovery. My doctor explained that a hot shower and having hot tea helps to mobilize the bowels and also helps to get rid of gas pain. My favorite is ginger turmeric tea that has anti-inflammatory properties, and I know I've said this before, but I always get my teas from Bushwick Tea. They've kindly offered to give a 10% discount to all of you on any of their organic teas. Please check out the description box for more details. Number five, taking painkillers after endometriosis surgery. I found it very important and helpful to take painkillers post-surgery. Why? Well, apart from the obvious fact that you have had major surgery and that it will hurt, but it's also important to have reduced pain so that you can get sleep. And sleep and rest are very important parts of recovery, so don't fight the desire to do either. Give yourself the time you need because we all have different issues. The extent of our surgery will be different and our bodies will react differently. So best to listen to yourself and take extra care. Number six, taking laxatives and anti-gas medicines after excision surgery. You don't want to be pushing your bowel movements. You've had surgery, your insides are sore, and my doctor has always advised me not to push. This is where the doctors suggested laxatives and anti-gas medicines help. Take them as instructed, and as mentioned earlier, have the hot tea and the hot shower. It'll be the best thing you would have done for yourself in the first few days after surgery. Also, don't worry if it does take you a couple of days to get the bowels going. It's supposed to be quite normal. Number 7, eat right after endometriosis surgery. I don't mean eating actually right after it. I mean eat the right things. Initially, it's always best to stick to foods that are non-spicy, light, and easily digestible based on your own diet. You will be able to identify what those are. For me, it was homemade soup and lentils that fit in my endo-friendly anti-inflammatory diet. I've already done a video on my endometriosis friendly diet in detail, so please check out the description box for that. Number 8, laying down correctly after laparoscopic surgery. I had stitches in 4 areas: my belly button, lower abdominal, towards my left hip, and towards my right hip. You're expected to lie on your side, which I thought was ridiculous for me. I didn't have a side which didn't have stitches, so I had to sleep on my back. It was the only way to avoid excruciating pain. I kept a pillow under each side of my hip, which covered only 50% of the pillow, so I was on it for 50%. This propped me up a bit, gave me a bit of support and assistance to help me get off the bed. It takes quite a bit of core strength to get yourself seated, so please take it slow. Number 9, aftercare of stitches. Initially, stitches have a dressing to cover them, which my doctor removed and cleaned up for me after 5 days of surgery. Stitches usually dissolve on their own, so there isn't a need to have them removed, but it's always best to keep it clean. Be gentle around the area when in a shower, and it's also advised to keep your belly button area dry by using a soft tissue or a cotton wool after a shower. My doctor advised me to apply some coconut oil on and around the stitches 6 weeks after surgery to help soften the skin. Now, let's get on to the 5 things of what to expect after laparoscopic endometriosis excision surgery. 1. Expect complications and expect the obvious. This is a complex, multi-organ surgery with a lot of unknown factors facing the surgeon. Let me explain. Here's the obvious expectation of what to feel, see, and hear when you wake up from surgery in the recovery room. Grogginess, dizziness, nausea, a heavy head, very sore stomach, attached to an IV, being able to hear the heart monitor beep with a nurse looking over you and saying, hello. But here is the one major thing I did not expect. I did not expect to wake up and go home with a Foley catheter attached to me. I didn't even know what it was. Complications or errors during surgery can occur. That's why you're made to sign so many consent forms. But I guess I didn't know what it would mean to have one, what it would mean to have a complication. So during my surgery, a bladder defect occurred. A small hole happened in my bladder, which needed to be repaired during surgery. And so I was attached to a Foley catheter for 5 days. The worst 5 days ever. Trust me, by using the word worst, I'm downplaying it. It's unfortunate that doctors don't explain the possibility of what can go wrong and what they may do about it. But then again, maybe I'm being too harsh. Maybe there is too much to explain, yet I still feel some common complications should be explained. What is even worse is when you're explained how to handle a Foley catheter, you are drowsy from multiple painkiller dosages and are still recovering from your anesthesia, yet you need to understand everything being explained to you. You're not given any written instructions either. Well, the hospital in New York didn't. But you deal with it and you scream and shout for 5 days, and you generate immense respect for everyone who has to go through a Foley catheter. Number 2, vaginal bleeding after endometriosis surgery. Sadly, it is normal. My doctor had explained it is normal to have vaginal bleeding for up to 2 weeks post-surgery. Number 3, the first period after laparoscopic endometriosis excision surgery, it is hell. It is so painful. If I thought endometriosis pain was bad, this was the worst pain ever. Plus the bleeding was just way too heavy. A week into the bleeding, when I saw no possibility of it reducing, I called my doctor and I was told that I should expect a reduction 10 days into the period, and typically the first period lasts around 14 days, which they told me before. So, but yes, day 14, it all stopped, thankfully. But even my second period post-surgery was just as painful, but at least this time it only troubled me for 7 days. So please be well prepared to place your hot water bag. I had to keep 2, one on my abdomen and the other on my lower back. This was the only way I could get through those days. Number 4, let's address an important question. How long should I expect before the pain reduces? Now, doctors say the abdominal tenderness starts to reduce after 3 days. I believe this is relative. I have Ehlers-Danlos syndrome, so my doctor was very clear that it would take me a lot longer because EDS patients are slow healers. It took 6 weeks for my tenderness to reduce and feel a bit normal. That's how slow my healing was. Today, as I record this video, 1 year on from my September 2019 surgery, I still go through some pains. So yep, it's all relative based on our medical conditions, the extent of the surgery, the organs involved, and also how careful we are in our recovery. It all matters, it all plays a role. Number 5, another important question, although similar to the one before, how long does it take to heal from endometriosis surgery? So this is about healing and the earlier one was about pain. Now, healing depends on how well we rest, how well we follow doctor's instructions, and the extent of our surgery. There is no one size fits all here. Initially, I was told I would feel better after 3 months, but 2 months into recovery, my doctor explained that I need 6 months before I should expect to feel better. Even that would need to be reassessed to know if I was on track. I was explained that a lot of this is down to 2 factors. 1, slow healing from the Ehlers-Danlos syndrome. 2, the surgery was deep and extensive. I believe even though I still have some surgical pain, but I have felt like I have been healing. So please get assessed regularly by your surgeon and keep him or her in the loop. If you face any issues, do not suffer in silence. That's about it from me on this post. If it's been helpful, then please do share this with others. And if you have any tips to add, then feel free to comment below. Please do like, share, and subscribe, and please press the bell icon. Thank you for watching.